Welcome to another Medicare e-course. I hope you are getting a lot of valuable information from it. And today we are talking about Medigap versus Medicare Advantage plans. Now there's a lot of information in this email, but I'm going to also share with you a little bit in this video. You'll find in the email that I am drawn towards Medigap plans. I'm not really a big fan of Medicare Advantage plans. But this isn't about me, it's about you and making important decisions about your benefits. So let me share with you a little bit about Medicare Advantage plans and why I think Medigap is a better fit for people. So Medicare Advantage plans are HMOs and PPOs, and most people know how that works. You have to use service providers when it comes to HMOs and PPOs, and you can't usually go out of network, and if you do, there's a higher cost to you. So it makes traveling to your next town, county, city, state, really difficult when having a Medicare Advantage plan. Now, I really know that most people are drawn to Medicare Advantage plans because of the low premium that comes with it, but I like to remind you that even though it's a low premium on the front end, oftentimes you get caught with medical expenses on the back end. And so what do I mean by that? Well, let's compare how Medigap works. With Medigap, it works with Medicare Part A and B. So Medicare Part A and B pay for 80% of your health care costs. And that means you're responsible for the remaining 20%. Well, that's where Medigap kicks in. A Medigap plan will cover that 20% coinsurance. So you know what to expect when you go to the doctor, the hospital, or have an outpatient service. You know what to expect. 20% is going to be covered by your Medigap plan. You're not going to get this crazy bill in the mail. On the flip side of that, with Medicare Advantage plans, you are responsible for the coinsurance, and it's 20% with most companies. Now, there is an out-of-pocket limit, and right now, it's probably around $6,700 as the maximum, but it varies with the companies, and as the years go on, it could get a little bit higher, but it definitely does vary. But just in general, about $6,700 is the out-of-pocket limit for many Medicare Advantage companies. So what that means is you're going to pay all the coinsurance up until you meet that, and then you're 100% covered. But it's not 100% covered for the remainder of the time that you have that policy. It's just for that calendar year, and then it resets in January, and you start all over paying the coinsurance until you meet that out-of-pocket limit again. And also you have copays. Copays to the doctor and copays when you are in the hospital. So you're not really getting this plan for free when you have a $0 premium. You are paying for it on the backside, as I like to put it. So it's one of the reasons why I really like Medigap a lot. I also like it because you're free to go to whoever you want, whoever accepts Medicare in your next county, your next city, your next state. Anywhere in the country, anyone who accepts Medicare, you can go to them, and you don't need a referral. You don't have to get permission from anyone like you do with a Medicare Advantage plan. You just go, you make your appointment, and all is good. And your Medigap insurance goes with you, because how it works is if Medicare pays the bill, then Medigap is going to pay the rest of it, as long as it's a Medicare approved item, as long as you went to a Medicare approved facility, all is good. With Medicare Advantage, you're kind of pigeonholed, I guess I want to say, into only going and doing what they want you to do. So that is another big reason why I like Medigap over Medicare Advantage plans. And then for some people, they like the idea that you get your drug coverage in a Medicare Advantage plan, whereas with Medigap and with Medicare, you have to get a separate drug plan. And I get that. But keep in mind that drug plan that's in the Medicare Advantage plan, it's one type of drug plan. Your drugs may not be a good fit for it, because every drug insurance company treats drugs differently. They tier them differently, and they'll pay for them differently. So it's not a one size fits all. So your drugs may not work well with a particular Medicare Advantage plan and may work better with a standalone Medicare drug plan. Medicare has hundreds of drug plans in their database for you to choose from. So keep that in mind as well. And I'll leave you with, let's see, I already go over the story of my mom and her Medicare Advantage plan dilemma in the email, so I won't cover that. But I did have a Medigap client reach out to me recently about a question that he had. But in our conversation, he said, I am so glad that I decided not to get a Medicare Advantage plan because a friend of his did get a Medicare Advantage plan. And then, I don't know, soon after that, got unfortunately into a really bad car accident and was in the hospital for quite a while, along with multiple surgeries, and is now receiving many bills that they're responsible for because they have a Medicare Advantage plan. And you're responsible for the coinsurance, you're responsible for the co-pays, and any other treatments that are necessary while you're recovering. So keep that in mind. These are things that are important to know when you're making these decisions about your Medicare benefits before you're signing up for Medicare. So read the rest of the email because you'll get more information. And then, of course, if you have questions, whether they're Medicare Advantage related or Medigap related, just hit the reply button in the email and send me your question. I'll be happy to answer it. And as always, I hope you continue to enjoy this course, and I will see you in the next video. Bye for now.